The idea of balance and falls is all about training your nervous system to pay attention. We typically fall when we least suspect it. We don't see that little step or stone or obstacle in the way, animal, curb. And what happens with some folks who have thin bones? Fracture. Fracture mainly because of the bones can't take the impact. It's not so much the fall that causes problems, it's the landing, it's the impact. And some bodies have gotten to the point where their bones just can't handle the load. That's usually associated with osteoporosis. Many of you know what that's about. This is a picture of normal bone. You can see how dense the framework is for the bone structure in a healthy 30-year-old bone stock. And here is a picture of an osteoporotic vertebrae. You can see how thin the framework is, the internal structure of the bones. Osteoporosis will be discussed in a different webinar, but the idea is that if something overloads the system, like in a fall or in a landing, the bones can break. Astronauts get osteoporosis because there's no weight bearing on their bodies, so they actually have to work very hard to maintain their bone stock. What happens if you fall? You can get injury. You can, in this case, you injure a disc, it slips out of alignment, and you can have back problems, or even worse, you can get a compression fracture of one of your vertebrae. And sometimes you'll see that in folks that have spontaneous fractures of their back. This is a woman who's leaning forward because of the osteoporotic fractures. But today we're not talking about osteoporosis, but about balance and falls. So why do we fall? Well, typically we're doing too many things. You're occupied, your brains, your mind is in a different place. It may be either an external factor, like you trip on something, or something internal. Maybe a funny beat of your heart, maybe medications causing some altered effects on your brain. So the bottom line is that as we season, you need to really pay attention to what you're doing when you're out and about. If you're going for a walk, look for where you're going to fall, and you won't fall there. It's typically when you're not paying attention, you trip on a rock or a little stone or whatever, and down you go. Using canes or walking sticks is not a bad idea. Why? Because if you look at your base of support, so if you look at this diagram of a person using a cane and you draw a circle around the cane and around his feet, as long as he or she keeps their center of gravity within that circle, they have a much more stable foundation. Same with somebody that's using a walker. If you can draw a circle around the walker and their feet, and as long as their center of gravity is inside of that circle, they're going to be usually upright and stable. If you think about somebody who's been drinking too much and they might walk with a wide gait. Why? Because their balance is off and they're keeping their center of gravity inside of their feet. So how do you prevent falls kind of proactively? Well, the key thing is to train your brain how to remember what your feet are doing. Many times it's simply a matter of our body getting a little bit out of balance, and all of a sudden you're outside of your center of gravity, and your base of support is no longer containing your center of gravity, and over you go. It takes time and practice. Think about the ballerina. They're dancing on point. Their center of gravity is running right through their body, their legs, and centered on a small little area at the base of their feet, and they can spin on that little dot. That is practice. That doesn't happen day one with ballerinas dancing on point. So how do you improve your sense of what your feet are doing? Well, Some very simple things. Tai Chi. Tai Chi has been shown to improve balance and actually prolong life, mainly because it prevents falls. The statistics are pretty grim if you have a fall in your older years. After age 70, 75, the risk of hip fractures and falls goes up logarithmically. And the life expectancy for somebody that's over 80 with a fractured hip in 1 year is 25% mortality. That's very, very severe. So the whole idea, and it could be even higher as we age. So the key is prevention, prevention. Whenever you can, try to just stand on your toes. Stand next to a cabinet or a countertop, whatever. Hang on to something. Rise up on your toes. It'll help your brain learn how to balance on your toes a little bit better. Even better, try standing on one foot. Stand next to something that's stable. Stand next to a countertop. Something that you can hold on to in case you do tip over. You don't have to be an expert yoga guru to practice this, but whenever you have the opportunity, practice standing on one foot. You should be able to stand on one leg for 30 seconds without falling. That's typically the metric that we use to see if somebody is at risk for falling. Things you can do in your environment is get good night lighting. If you go to the bathroom at night, make sure you've got a very clear path to the bathroom and you can see the floor so you can avoid the cat or dog that's lying in your way. You get rid of the throw rugs that might have a lip that's bent up that you could trip on, and make sure you've got grab bars and things. Place the furniture in such a way that if you do fall, you can grab onto something. But night lighting is really important, along with if you get up in the middle of the night, just stop and pause at the bedside and just wait for your blood pressure and everything to equilibrate so you can have good sense when you're walking to the bathroom, not half asleep. The other recommendation, which is somewhat different, is if you have glasses for both reading and far vision, in other words, bifocals or progressives or things like that, these things kill people. Why? Because the near vision field is in the lower part of the glasses. So I've had many patients who have missed the last step, missed the curb, didn't see the rock because they were wearing these multi-use glasses where the lower part of their lens cannot focus well on what's on the ground. It can see something that's arm length so you can read, but it doesn't see what's right in front of your feet. And just having glasses that are designated for outside use and some just for reading is my recommendation. The progressives do cause problems. So those are a few things that you could try. Again, the whole goal is prevention as much as possible. We'll talk about osteoporosis on a different webinar, but the take-home point is that if you work over time to train your brain to know where your feet are, you will likely prevent a fall, an unnecessary fall, which can lead to your demise. So with that happy note, enjoy your Tai Chi, enjoy the balance, enjoy single leg standing, enjoy all the things that you love to do, and we'll take care of you no matter what happens. But if you have any questions, certainly give us a call or come in for a visit, and we'll be glad to talk about other techniques for improving your balance, some more advanced things. But start simple and make it consistent. It's all about repetition and consistency. Have a great night.